Welcome to Audio Guide 4 for Talking Head Pain, produced by the Global Healthy Living Foundation. Whether you or someone you care about have migraine, or think you or they might have migraine, these audio guides are designed to help you make sense of the headache and other symptoms. Accurate information will help you work together with your healthcare professionals to hopefully have fewer and less severe headache episodes. The good news is there are more effective, safe treatments than ever before. There is also more evidence than ever that a combination of medicine and a healthy lifestyle are the most successful approach to managing migraine. In this audio guide, we share lifestyle changes you can make, integrative therapies you can try, and other ways of living well with migraine. In every audio guide, we provide information checked by medical professionals who specialize in migraine and other headache disorders. The guides are also reviewed by people who have migraine and understand what it is like to live with recurring headaches. Suggestions for care, including the lifestyle changes we talk about today, are based on guidelines from the American Academy of Neurology and the American Headache Society. As you try lifestyle changes and integrative treatments, you will find some work better than others, not only for your migraine, but also for you as a person. We recommend trying one change at a time for a few weeks. Keep notes, ideally in your migraine diary. That will give you a record of what does and does not work. Share the things you are trying with your healthcare team just like you share your overall health information. Not every treatment works well with another, and your healthcare team may have experience and knowledge about combinations that could be unhealthy. Please remember, headache of any kind is a medical issue. Always talk to your healthcare team if you have a headache that bothers or worries you. That goes for headache treatments too, whether medicine, exercise, or sleep habits. If something you try doesn't feel right, work with your doctor to find out what is best for you. There is increasing evidence that a healthy lifestyle protects the brain, reduces migraine frequency and severity, and even has a role in preventing other brain diseases like Parkinson's and Alzheimer's. Dr. Jennifer Robley and Dr. Amal Starling are neurologists who specialize in headache disorders at the Mayo Clinic in Scottsdale, Arizona. They created the easy-to-remember acronym SEEDS for self-care techniques to help reduce migraine attacks. S is for sleep. Not enough or too much makes migraine attacks more likely. The healthiest sleep habit for most people is 7 to 8 hours every night. You can make that more likely by developing a sleep routine. Turn off electronic devices 1 hour before going to bed and set a consistent bedtime and wake time for every day, even on the weekend. If consistent sleep is hard to achieve or you feel tired during the day, talk to your healthcare team. Consider specialized cognitive behavioral therapy for insomnia, which is a short-term therapy proven safer and more effective than medicines to aid sleep. E is for exercise. There are almost too many benefits of regular exercise to list, including reducing heart disease risks, improving brain health, maintaining a healthy weight, and sleeping better, all of which also improve migraine. Exercise can also help with stress management and improve your mood. Aim for 150 minutes of moderate exercise each week, whether that is in 5-minute walks twice a day or 50 minutes of a vigorous workout 3 times each week. What exercise you do and how often you exercise is less important than finding something that you enjoy enough to do regularly. There is also evidence that people with chronic migraine who use preventative treatments have fewer migraine days each month when they exercise at least 2.5 hours per week. The second E in SEEDS is eating and drinking. Eating regular heart-healthy meals, drinking plenty of water, keeping alcohol intake moderate, avoiding caffeine, and not smoking all reduce migraine frequency. These also help you stay healthy in general. Avoid skipping meals over or overdoing it at a single meal. Drink 1 8-ounce cup of water 8 times a day to stay hydrated. Keep alcohol intake moderate, 1 to 2 drinks per day or less, and avoid caffeinated beverages. If you do drink coffee, tea, soda, or energy drinks containing caffeine, try to keep the amount small and regular. Changes in caffeine intake can cause migraine attacks. If you smoke cigarettes or cigars, your healthcare team can help you access resources to help with stopping. D is for diary. We've talked in earlier audio guides about the importance of keeping a diary of your migraine attacks to help you and your healthcare team know the ins and outs of your migraine and your migraine treatment as it affects you. Record the day and time an attack starts and ends, what medicine you took, if any, and how well it worked, and how the attack affected your ability to keep doing your usual activities. The second S is for stress management. Stress is a big migraine trigger for many, with some people experiencing high stress just before an attack that decreases as the attack resolves. Other people are more aware of stress during the painful phase of migraine attacks and others have stress that doesn't change during migraine attacks. Of course, the idea of managing all the stress in your life may even make you laugh. So much of what causes us stress is outside of our control. Still, even when it is not possible to reduce your stress, you may be able to find healthy ways of coping with it. Exercise, gardening, other hobbies, meditation, yoga, tai chi, mindfulness, and relaxation techniques are all known stress reduction tools you can experiment with in case one of these will work for you. In addition to sowing seeds for success with self-care, integrative non-medication treatments may help make migraines less frequent or less severe. Cognitive behavioral therapy is one of the best proven methods for improving migraine. This therapy helps people control the thoughts and reactions they have about their pain, which can reduce the stress of having to handle something so difficult. Cognitive behavioral therapy reduces stress and improves mood. If, like so many people with migraine, you also experience depression or anxiety, cognitive behavioral therapy will likely also help with these. Although there is certainly a psychological component to how we perceive the pain we experience, the fact that therapy is helpful does not mean migraine is all in your head. Migraine is not a psychiatric disease or a psychological problem. It is a biological and chronic disease. Suggestions that it is anything else are part of the stigma we are working to change. No matter what chronic condition a person has, epilepsy, diabetes, or high blood pressure, managing stress and emotions helps people manage chronic health conditions. Biofeedback is another integrative technique that can help with migraine, although it can take a long time to become effective because it is a learning process. A trained biofeedback therapist uses small electric monitors to help you learn to recognize changes like muscle tension, body temperature, and breathing and heart rates. As you learn to recognize those, you can address pain sooner and may be more able to address and manage it. Some people find a massage to relax muscles and the mind is helpful. The ancient technique of acupuncture is also helpful for some, although there is no clear evidence of why this is so. Devices that modify the light you were exposed to may also help. Glasses that block blue light have become more commonly used and more commonly available, but most were not designed specifically for people with the light sensitivity of migraine. Two companies that do produce glasses specifically for people with migraine are Theraspex and Axon Optics. Another light-related integrative treatment is the Alley lamp, which uses a specific wavelength of green light. Some research suggests that this can decrease pain during a migraine attack. Some people say using the lamp regularly also decreases the frequency and severity of migraine attacks for them. There is limited evidence that any herbs, vitamins, or supplements help with migraine. Butterbur has the best evidence, but can be dangerous and harmful to your liver if it is not free of pyrrolizidine. Because this chemical can contaminate butterbur, you must have your liver function closely monitored by a doctor if you use it. Riboflavin, vitamin D, magnesium, or feverfew may also help with migraine and are generally safe to try. Always tell your healthcare team about any supplements or over-the-counter medications you use, because they may interact with migraine medications or not work at all. Vitamins, supplements, and herbs are not regulated as strictly as medication, and the quality and potency can vary widely. There is a stigma around migraine that causes many people, perhaps even your loved ones, to brush it off as nothing serious. But whether you've lived with migraine for years, just recognized your attacks are migraine, or just started having them, you know it is so much more than just a headache. It is not uncommon for migraine to be severe enough to prevent people from working, doing household chores, or attending family and social events. Migraine can take a dramatic physical and emotional toll. Educating yourself, your support network, your coworkers, and other people can be helpful in overcoming this very negative aspect of headache. You can join support groups and patient advocacy organizations that help you do this. Participating will put you in touch with people who have similar experiences, making isolation less likely because you will know that you are not alone. If you are wanting to know more about medication, listen to our audio guide on migraine medication options. If you are wanting to know more about migraine, listen to our audio guide on what is migraine and our audio guide on migraine diagnosis. If you are needing further guidance of managing migraine in social settings, listen to our audio guide on managing migraine in the workplace. For more medical information and advice about your own migraine treatment, speak to your doctor.